I think that the story that we just heard is a typical story, and I think it put on a very personal basis the struggles that one business executive has trying to figure out what's the right thing to do for their company and for their employees. And on the one hand, recognizing, Michael said, that the employees are the most important asset of the organization, and wanting to keep them engaged and happy and satisfied and productive. On the other hand, recognizing that they have been facing double-digit increases, and although he said he switched carriers many times, he could have just said he was with Blue Cross the whole time, and he could have had that experience as well. So I just wanted that we went through a period for 5 or 6 years in a row where the average premium increase for small and large customers was 10, 11, 12%. And I think employers just said, I can't take it anymore. And it was hurting their ability to hire new workers, to invest in their companies, to expand. And by the way, the other big sectors that buy insurance, government and families and individuals, were feeling the same thing. Government priorities for important things like education and transportation infrastructure were not, we couldn't invest in that, and families themselves were having a very hard time paying a family premium of $15,000 a year. Imagine being self-employed and having maybe a combined family income of $60,000, $70,000 and having a $15,000 health insurance premium, which is not sustainable. The decision that you came to was a increasingly common one, that for years, the only real option that we could offer for an employer, when we went and they said, we want to renew our coverage, we like our coverage, we like you, our employees are happy, they love having that Blue Cross card. And by the way, we have other very good health plans in the state who will be sitting here in other forums and do a fine job. And they said, look, we can't pay that 10 or 12% increase. And we'd say, well, you can increase the cost sharing. You can increase the co-pays and deductibles, and that's a way that we could maybe cut the premium in half. And often they would do that. And what we came upon with this, for a whole variety of reasons that I want to get into, was here's an alternative. Rather than increasing the cost sharing for all your employees, let's engage your employees in the questions about what their own healthcare purchases. And let's engage them in the question of value in healthcare. We ask ourselves for almost every purchase we make in our economy, what's the value of the purchase? But we have for years not said that in healthcare. And I would suggest to you that our failure to do that demonstrated that our whole business model for healthcare was broken. If you look at the three of us up here as the three key players in maybe as consumers, maybe Sandy will be the consumer for a second. But here you had an employer who essentially said, we'll pay for your benefits and give you essentially unlimited benefits for essentially no cost. It was the equivalent of some people say, here's a restaurant menu, no prices. So that people order the steak and the lobster. Well, if that's what they like, that's what they'll order. There's no consequence. And then we would pay hospitals and physicians for every service they provided. And the more services they provided, the more we paid, without any regard to outcome. And then the physicians and hospitals would then be incented to provide more services, and while they obviously had their clinical and ethical restrictions on how they would prescribe services, they had an incentive that I know Gene, because he's such an honest person, will readily acknowledge we're there to do more. And so the fundamental business model that we're all participating in is broken. And it's been broken, and I think we now realize that. I think what's exciting in Massachusetts is that in part because we have everyone covered, we've turned to let's change the business model for all of us. We all have a role to play, and it's challenging for each of us in different ways. But I think we are changing, and over the next decade, I think we're going to change in such a way, and we're already seeing very promising results, that rather than having premium increases of 10, 12, 14%, the last year we've been averaging premium increases of 2, 3, 4%.